identified a few calluses, virtually see all calluses, and then pelvis is visible. Then the callus is dilated, so renal pelvis dilated, pelvic acid pattern, blunting of fornices, lateral papilla, ballon PC system, severe. પહેલા pelvis visualize છે. Calluses visualize થાય છે, that means it is severe form of hydronephrosis. Usually, if only dilated pelvis, it is mild grade. But once calluses system is dilated, it is moderate. And fully pelvic system dilatation with thinning of parenchyma, cortical thinning, it is a gross hydronephrosis. Bilateral hydronephrosis with hydroureter. In bilateral hydronephrosis, there is bladder outlet obstruction, distal obstruction. Benign prostatic hyperplasia, stricture urethra, bladder tumor, extrinsic compression of both ureters, as it happens in post-radiotherapy, retroperitoneal fibrosis, retroperitoneal malignancies, bilateral congenital usual obstruction. It is not uncommon. Although not common, but not uncommon. Retrograde pylorography, if pelvic system is visualized unilaterally, then it is retrograde pylorography, and lower down catheter is visualized. So endoscopically, one side of ureter is cannulated, that is called as retrograde pylorography. Blue kidney દેખાય છે, blue ureter, it is descending pylorography or IVP, intravenous pylorography. Intravenous pylorography is also called as descending pylorography. This is retrograde or ascending pylorography. MCU, RGU, MCU, retrograde urethroplasty with micturating cystolurethroplasty. This procedure is usually simultaneous. Dye is injected per urethra. So urethra is visualized, dye is collected in the urinary bladder, and patient asked to micturate it. Picture is taken. It's micturating cystolurethroplasty. Usually ascending urethroplasty, AUG or retrograde urethroplasty, RGU with MCU. Indications are vesicular reflux, bladder anomalies, stricture urethra, vesicovaginal, rectovaginal history of the indication. Okay. How do I identify? This is the picture. So here syringe is there, cannulated urethra incontinently, dye is injected through meatus, and dye is going. Okay. Then we can see where is the narrowing. So why is two are required? Only ascending urethroplasty is sufficient. Can MCU જરૂરી છે? Sometimes what happens is complete obstruction. So dye is passing, and dye will not go beyond obstruction. Complete stricture, sir. So we cannot have any idea regarding segment of stricture, length of stricture. So MCU करो, MCU is proximal house, it is the length, and then there is a segment. The length of the stricture area is important. It will define type of management. Preferable management is endourology. VIU, visual internal ureterectomy. Simple short segment stricture can be dealt with VIU. This is best. Long stricture VIU cannot do. We have to do open ureterectomy. So ઉપરથી સપોઝ there is a complete narrowing, dye પણ જતી નથી, તો પછી MCU કેવી રીતે કરશો? For MCU, dye must reach urinary bladder. Bladderમાં dye જતી જ નથી, તો MCU કેવી રીતે કરશો?
Suprapubic catheterization થી direct bladder.
Because when there is a complete urethral stricture, patient present with retention of urine. So when there is a retention of urine, we are not able to perform catheterization. Catheter જવાનું નથી. Then we do SPC process. So all patients with complete urethral stricture will have SPC already. So we can do MC. Most common area, most common part of stricture urethra is prostatic urethra. So penile urethra, vulvar urethra, and
membranous urethra.
You come in. Why it is the most common prosthetic? Because there is bending there. તો ત્યાં narrowing હોય છે અને bending હોય છે. Most common injury over prosthetic urethra. Manhole injury or fall astride between two legs. This is the area of prosthetic urethra, posterior urethra. Injury હંમેશા ત્યાં થશે. Mammography. Just look at these are the basically this is the good screening investigation for breast carcinoma, benign lesion and malignant lesion. In young female, mammography is not useful, but yes, in middle age and old age, mammography is very useful investigation. Microcalcification are nicely visualized in mammography. Even MRI cannot pick up microcalcification. Normal mammogram, benign cyst, smooth rounded, smooth surface, no speculation. Cancer has a branching and speculation irregular surface and calcifications. So, what are the projections?
Retroposterior, mediolateral oblique. Mediolateral oblique.
Mediolateral oblique and retroposterior. Which projection covers largest volume of breast? Cranial border. Cranial border. Mediolateral માં એક જ બાજુમાં આવશે, cranial border માં બે બાજુમાં આવશે. Cranial border covers largest volume of breast and mediolateral. So oblique and cranial border is formed on the breast parenchyma, and oblique picture form pectoralis before and axilla. Pectoralis before and axilla. How it can be done? It is not invasive, okay? It is plain X-ray. The eye study nothing. And ductography is the eye study, non-invasive. So just there are two plates, breast is placed between two plates, and X-ray is done. And it is very easy to perform, non-invasive, and very practical. Chest X-ray. Chest X-ray નો વારો આવે તો બધા એડજસ્ટ થઈ ગયો. A B C D E બરાબર. એબડોમેનમાં શું હતું? Abdo-X. Airway, bones, circulation, diaphragm, emphysema and everything else. Airway मतलब just look at the airway first. Trachea to carina. Trachea જુઓ, bifurcation જુઓ. Straight in midline, any narrowing, angle of carina more than 100 degree. Something is there, angle of carina will be enlarged. Bronchi. See bronchi, bronchial tree, narrowing, cut off, foreign body. See lungs, symmetry of all zones, densities, volume, vessels, branching progressively, extra lines in periphery, bones passing through lips, posterior or horizontal, lateral and anterior part on both sides, any fracture or other abnormalities. Any bone break in line, break in outer line, cortical line, that is a fracture. And continuity of line should be there. Clavicle, scapula, above humerus, cortex and bones. Vertebral bodies, similar shape, rectangle, height journey to pedicles and intervertebral spaces. Up to visualize करवाओ. Seat for circulation, मतलब cardiac size and position, 1/3 right and 2/3 left. And as well, cardiac silhouette क्या है? So क्या है? Cardiac silhouette. Cardiac borders, cardiac thoracic ratio less than 50% is normal.